Good afternoon. Well, listen, today I would like to start. And to start with, I'd like to talk a little bit about what happened recently, what's been happening since this spring, and so that we can better take stock of the current situation that we're facing. Let's remember, in March, there was a first wave, and this was a strong wave, very strong so, and we had to close the schools, and we had to close pretty much all businesses in Quebec. Following those efforts, in spring, things calmed down. There was the month of June, and the rise went down. The situation was calmer, and we were able to open or reopen. What do we say in French? Rouvrir, reopen. So we reopened, réouvert, rouvrir. These are the French terms. Okay. Rouvert, reopen, reopened. Okay, anyway. It seems that I'm not the only one having these French difficulties. So we had a beautiful summer, and we were able to do a lot of activities, and we were used to during the summertime. I mean, still, things were different from spring. We had to wear a mask, and we had to be at a distance, 2 meters away from people. This did not exist before. There was spring. The department implemented those measures, but in spite of that, in spring we had a second wave, and then it was really concerning. We went from 100 of new cases per day to about 1,000 new daily cases. And the concern we had then, Dr. Arruda, the health minister, and myself, we wondered, are we going to go up and reach 2,000 and 4,000 patients, and then we'll reach an overcrowding in hospitals? And at the end of September, in October, we had to announce measures. We had no other choice. But let's be clear. I want us to be clear. A lot of people are talking about a lockdown, but what we did has nothing to do with what we would have done in March or April. What we did is that we closed in red zones the bars, the restaurants, the theater, event rooms, and some collective centers. And we asked people not to welcome any guests at home. These are strong measures, harsh measures, but it has nothing to do with an entire lockdown, including businesses, schools, and so on, what we saw in spring. It's very important to say this. We don't do this for fun. I want to repeat this often. There are 3 reasons. Number 1, we want to save lives. Even today, 28 deaths today. It's true, lives are at stake. Number 2, we want to save our health network. We want to continue offering operations, surgeries, treatments. I'm looking at the situation. There are people with cancer, and they say this might not be a terminal situation, so people decide to wait for a few months, and so on. There are people on a waiting list. Also, if you want to cut down on waiting lists for surgery or treatments, well, we have to consider that our staff is limited. There are scarce resources, and they have to take care of people with COVID. And third reason, which is a significant one, a very important reason for me, and I hope it is so for all Quebecers, we want to enable our children to go to school. There are about 1,000 classrooms that are closed. Maybe 3% of children are not going to school, but 97% of children go to school. And this is very important. So I'd like to continue with my analysis. At the end of September, at the beginning of October, we thought, and we said, let's try to make an effort for 28 days. This is half of the 28 days. Today is October the 15th. And what we see a great news. I mean, we didn't reach 2,000 cases on a daily basis. We have reached a plateau, about 1,000 cases per day. Sometimes we are at 800 cases. Sometimes it's a little bit more. Today, we have 969 cases. We are around 1,000 new cases per day. This is what we've reached, that plateau, for about a week. This is good news. Is this enough? No, it's not enough. We have to be able to decrease the number of cases. So we don't know what will happen in the upcoming weeks, in the next 2 weeks. But I'll be honest with Quebecers, it's very likely that part of the measures that we've implemented for 28 days, while saying this could be longer, it's possible that part of these measures might be extended. And again, Dr. Arruda knows that there's a measure I really don't like. It's about sports for the youth. This is a matter of balance. There's public health on one side. On the other hand, there's mental health and quality of life for our youth, young people. So I don't want to put too much pressure on Dr. Arruda, but if after October 28th, if we could allow young people to do some sports, I'd be very pleased with that. Now, something else that I really want to do is I want to say, okay, there's Christmas. It's around the corner in a way. There's Christmas, Christmas time, the holidays, and of course, it wouldn't be great for Quebecers if you couldn't see your friends and family members at Christmas time. This would be really sad. Now, how will we deal with the situation? It's too early to say. But will we be able to gather within a group of 6 people, 10 people? It's too early to say that. But what we can say right now is that we should forget about big Christmas parties with comprised of 100 people and so on, big office parties or big extended family reunions and so on. We should forget about that. 8 brothers and sisters at the Legauts, the Legault family. So you can have family parties comprised of 100 people too. We had a big family, but we should not think about that for this year. Now, something else. We've been talking about this for days, and it seems that this seems a secondary issue, but I have kids, so I know this is very important. It's Halloween. Halloween is in 2 weeks. So that's the time you need to create your own costume, to design it or think about it, and make your own costume. Halloween is celebrated outside, usually. It's less risky outside, right? There's less risks outside than inside. So I'm announcing you today something great. This is good news. There will be prerequisites, there will be some guidelines to follow, but we have to allow our kids, our children, it's very important for them, it's important to allow them to celebrate Halloween. But 2 very important guidelines that they have to follow. The first thing we have to comply with, number 1, we won't be able, unfortunately, to celebrate Halloween with your friends, with other people. We will have to celebrate with people living in the same house residence, for if you have sisters, brothers and sisters and so on, or parents if you're a child, but you won't be able to celebrate Halloween with other people beyond your family unit, the family members that you live with. Number 2, the second guideline, this is important. People giving candy to the children, they'll have to do it in compliance with a 2-meter distance. In an ideal world, we would have a big basket and we would put some bags. You could put candy in small bags maybe and respect the 2 meters away from the candy basket. And then when children come, you ask them to take the bags and you tell them not to touch other bags. This is not the perfect situation, obviously. But the youth will be able to wear costumes. They'll be able to go and ask for candy, throughout the streets. So again, for 2020, for adults, there's no Halloween. It's just for children if they go from door to door. And again, let's talk about the children. They were somehow impacted. They've been impacted during 2 months, and I'm struck by their capacity to adapt themselves. People were concerned. I heard a lot of things. People were worrying about wearing masks. There's no problem wearing a mask in a classroom. That's what kids say. So sometimes we assess evaluate the capacity that children have to adapt to a given situation. Now, I don't want to be on the defense side of things, but we have to give ourselves comfort. We're facing the same situation as anybody else around the world. We face the same situation with the same types of measures. I'll give you some numbers here. We like that. I know that the health minister likes numbers. Let's take the number of new cases in Quebec yesterday. We had 969 new cases. This means 114 new cases per million of inhabitants. If we compare ourselves with the United States at a greater scale, yesterday they had 177 new cases per million. In UK, in England, they had yesterday 290 new cases per million of inhabitants. And in France, our cousins, they had 347 new cases per million. And so we might find 114 cases per million, a high number, but other places are worse. So the measures that I was announcing earlier for restaurants, bars, and so on, it's pretty much the same situation everywhere. Even if you listen, if you watch the news, if you see what's happening in France, for example. In France, the authorities have asked that everyone stay at home. So at 9 o'clock p.m., everybody must stay at home. Again, this is not part of our plans. I want to reassure Quebecers, we don't need to come up with a curfew measure for 9 o'clock p.m., like the Frenchmen. No. So when we compare ourselves, we can give ourselves some comfort because our situation might be more comfortable here. I conclude, we have a huge challenge in front of us. We face the same situation together. This is a world pandemic. We have to continue working hard. We have to limit contacts. We have to save lives. We have to keep our children in schools, and we have to save our health network, because if we're sick, we want to be taken care of. So I'd like to come back to the three same reasons that I gave you. And I would add a fourth reason. We have to make sure that we can celebrate Christmas with our children and our family members. And so we're doing our best and doing all we can do to reach that situation.
To break the second wave in 28 days. It now looks like we've been able to slow the contagion and keep the number of new cases at around 1,000 a day. But we must continue to reduce the number of new cases, and to be honest, we'll probably have to maintain some restrictions after October 28. My hope is that we'll be able to see our friends and family at Christmas. It's too early to say what form that might take, but it won't be large gatherings. I also get a lot of questions on Halloween. I know how important it is for children, and I have good news for them. We'll be able to celebrate Halloween if we follow two very important rules. First, children will have to stay with the people they live with. Second, people who give candies will have to stay at 2 meters. I also want to specify that you cannot organize Halloween party. This year, Halloween is only for kids gathering, collecting candies. We must continue to protect ourselves for 3 good reasons: to protect the most vulnerable, especially the elderly, to protect our health system and our health workers, and to keep our children in schools. And I would add a 4th reason, because we want to see our friends and family at Christmas. Thank you.
So this is the Q&A session. Please use the microphone. 1 question per journalist. We'll start with TVA. Good afternoon, Mr. Legault. You've seen the numbers from l'Institut national de la santé publique, the Public Health National Institute, and also the numbers from the Department of Health and Social Services. Almost 17% people infected amongst the people working in the health system for health workers. This is for you, Mr. Dubé, also. There were some measures that were enforced. A lot of progress has been made in facilities since spring, but still there are retention issues with the staff. Since we know more about aerosol, shouldn't we provide the N95 masks and make them compulsory for all the workers there because of that? Answer. Since the publishing, as you said it, and since the time when people were asked questions, this ended in mid-June, about that time, as you said it. We've implemented a lot of measures, and I'd like to say that we really analyzed that information. We really considered it highly because it helped us plan for the plan that we've submitted in mid-August for the second wave. I want to contextualize this. Since that study, as you said, a lot of things have been implemented, a lot of measures. I'd like to say that I think that still there will be some modifications that we might make. You're talking about N95, the masks. I think we've established with our CEOs for the cease and use facilities. We've had discussions all the time, every week. I see you every week. I talk to them, and I see how we can adjust things. I'm not saying that we'll do that with the N95 masks because there are discussions underway currently. There were requests from the FIC and the unions specifically on that, and some adjustments must be done in terms of monitoring infections and protection purposes. We'll do that. We must do them, and we'll do that. That's a principle. We are starting to do small verifications in CHSLDs to make sure that the plan we've implemented is complied with, because people said this well in this study. You've read it also, I'm sure. People might not realize that they were self-contaminated amongst employees. People were contaminating one another. Now that the rules are clear, we have to make sure that things are done the right way. Now, regarding mobility of staff members, this is very important an issue in regards to the different workers. This is planned for. We have a departmental order that will consider mobility for the staff members. So all the conditions will be defined there. This is way more complicated. This is more frequent because it's a management mode. Remember what I told you earlier. I want to reassure people that this study that you're referring to, this was published yesterday, will take that into account so as to make sure that the staff mobility is conducted in an environment where we can monitor infections and protect people. And notably, in regards to these workers. There won't be any curfew in Quebec, is that what you can say? No, we're not considering that for the moment. Mr. Dubé, you know fairly well that the FIC nurses will go on strike on October 24th and 25th. I would like to hear you on that. We're not there yet. We haven't reached October 24th and 25th. I think that Ms. Bédard's team and Ms. Lebel's team and all the teams are working very strongly. We've been working very hard in order to find some type of settlement. I understand the union position when they say it's one of their alternatives, but you know me well. I think that still there are a lot of days before October 24th and 25th. So I mean, both parties got closer recently, so I trust that they can get even closer. Any idea about the ratios? I'll leave that question to my colleague, because the further I am away from this, the more progress they make on that. So I'll leave it at that, and I think they will be able to find a solution. François Carabin, Journal Métro. Good afternoon. 28 new deaths today. This is not the final result, but 28 new deaths. Is it harder to prevent deaths given the variety of places where we see outbreaks? We had a very specifically identified outbreak origin with these CHSLTs. Is it different now? Is it more concrete? Answer: there are different reasons for that. I'm not expecting those numbers, and I'm not happy about that. Honestly, when I looked at the first numbers on the 28th, well, anyway, I want to bring this back into a context frame. One death is too much anyway for what I can endure every day. I'm not just talking about me, but I'm talking about everyone. But I want to put things into perspective. The challenge is that today, if we have 1,000 cases per day and we have hospitalizations, which are, 15 new admittances every day, it's huge. So we'll have deaths, for sure. I've said this for quite a while. Deaths are around the corner. We thought there were not a lot of deaths. Well, now we have the deaths. The number of deaths is more related to the fact that we went up, reaching 1,000, 1,200 new cases. They went to the hospitals, and these people are there, and so people will die. This is related to the high number, because of the last rise that we saw in numbers during the last month and a half. During the last 24 hours, I was told that today, we unfortunately should have a rate which should be about 10 deaths per day, if we just base ourselves on statistics. So if we are behind in terms of a few days because of the long weekend, because in certain cases certificates took longer to get, for all these reasons, it means that it can take 2 days, and then you're behind, you're late, and then all of a sudden you have 20 new cases. It's sad to say, because we're talking about deaths, and that's what it is. These are dead people. So we understand this, and this is more about the results in terms of the greater number of cases that we just obtained during the last days. So the best way not to have as many dead people is to decrease the number of deaths, to decrease the number of hospitalizations. This is the best answer I can give you. But I trust the numbers fully still, and I would like to remind you that that's why I made that decision. When I started 3 months ago, I said we will have to trust the mobile averages, as I call them, because on a daily basis, it's not enough. Now, we have about 10 deaths per day. That's what we've been having during the last weeks, but we have to bring this down, of course. There's a news, the Quiétude Squad, which was launched a year ago about, is 42 times more likely to charge a black person as opposed to a white person. What does this tell you about racism within the police? Is there a new definition now, the institutional definition, which was raised by the new leader of the Parti Québécois? What do you think about it? Answer. The study that you're mentioning, we are studying it. It was submitted by the same professor. He said in spring that we should release all prisoners in the summertime. Okay? This is to contextualize things. The same person coming up with this study was telling us to release all the prisoners in spring. We'll study this, of course, but you're, again, coming back to words. I think that there is racism in Quebec. What we want is we want to fight against racism. We don't want to use words to name things. What does that mean, institutional racism? How many institutions then? Ask your questions to PSPP, as we call him. Question, François Guéripi, Radio X, Quebec. If I'm here, it's because we haven't gotten a press conference since August the 18th in our sector. David Navarro, lately, Dr. Navarro from the World Health Organization, Special Envoy, he said that WHO does not consider a lockdown just in last resort. More than 20,000 scientists and doctors through the Great Barrington statement, say that we should leave people, lead a normal life, and just take care of the people at risk. On October 23rd or 24th, should we consider a new way to look at things? Mr. Radio X, I should not hide the fact that I have issues with you. But anyway, 28 new deaths. Still, that's what we have today. We have to consider that. But the document that you're quoting refers to confinement. As I was saying earlier, we are very, 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 very far from the spring lockdown when we closed all the schools and we closed pretty much all businesses. For now, we're not there. What we closed, it's restaurants, bars, theaters, some collective sports facilities. So let's be careful in using the word lockdown. Why do we proceed in that way? To bring the number of deaths down, 28 deaths from COVID. I don't like that, to save our health system, because we're reaching almost 500 people being hospitalized. That's 500 beds which are taken. Nurses have to take care of those people, 500 people, instead of enabling surgeries. And I want to make sure that all the youth remain in school. We have 1,000 classrooms almost where at least one child was infected. We had to close those classrooms. 3% of our children cannot go to school. I am really shocked by that. I invite the Radio X people, ask your listeners to comply with guidelines. That's what we do, Mr. Premier. An additional question. You said that this would never happen in Quebec, that we would have a curfew. But in the fact, it's even worse to have red zones because restaurants are not even open for most citizens. There's a constraint that's even more striking with a red zoning measure as opposed to a curfew. So we have the certainty. Are you giving us the certainty that we'll never have a curfew in Quebec? Answer. Well, no. Well, we could talk about France, what's happening there in certain zones, and in many states and countries around the world, restaurants, bars are closed. And what we are telling people is that in France, we're telling them, stay home, and you have to be at home at 9 p.m. That way, they make sure that they won't do any parties, they won't party in restaurants, houses, and bars. We're not there, though. That's not our intent to do that. But I invite you, again, to ask Quebecers. Ask them to respect guidelines. Don't do any party at home. Tell them that. Have a great afternoon. Thank you very much, Mr. Radio X. Mr. Legault, good afternoon. Let's come back to the curfew idea. You're excluding that altogether. If Dr. Arruda would tell you that this would be a good measure, would you enforce that? Answer. We don't know what the future will look like, but this is not envisaged currently. As I said earlier, listen, considering the few measures that we've announced a few weeks ago, 2 weeks ago, we were able to stabilize things with 1,000 new cases per day. And we hope to bring this down with those measures. We hope it will go down so we don't envisage adding new measures and coming up with a curfew measure. You've heard about this story about bingo in Saint-Jean-du-Richelieu. There was a positive case, coronavirus positive case in that bingo. Loto Quebec was organizing up to recently Le Bingo en Réseau network bingo activities. Do you think that the state-owned corporation has encouraged some gatherings that don't comply with sanitary measures? Answer. Well, listen, if we should entertain discussions with Loto Quebec, I will then make sure that I do so with my colleague in order to make sure that we're not mixing things up here. Let's come back to the principles issue with bingos. We'll deal with that Loto Quebec matter. If we need to clarify anything, we'll do that with them. But in conclusion, I don't want bingos to become the same thing as what happened with karaokes a few weeks ago. We don't want any gatherings inside, even in orange zone. When we say that, I don't understand how come people can decide to gather with 250 people for a bingo entertainment, and then everybody will shout jackpot at the same time. A few months ago, I wonder, we said something about bars. We said we shouldn't stand up and start singing, And then karaoke had to be, forbidden? We wondered about that. But now, if you're listening to us, if you want us to clarify the fact that a bingo session should not be happening in Quebec, we might have to do that because our goal was to limit gatherings. What's even worse with a bingo celebrations, that we do that with that activity is comprised of different vulnerable people, the elderly people. Now, let's be reasonable. In an orange zone, even if this was allowed with 25 people, these people had a bingo activity with 250 people, not even 25. We're discussing today about what are we going to do in order to have people follow measures, comply with them, and let's stop having 1,000 deaths or people infected per day, and let's have measures so that we can stop having deaths, the amounts that we have right now. So bingos are forbidden for that reason. Question from Cogeco. I'd like to come back to the Halloween announcement. Mr. Legault, how are you going to avoid creating a situation like the bingo situation? How can people respect the guidelines that you've announced, the 2 meters distancing? Will there be more police presence in the streets? How are you going to go about getting a Halloween celebration in view of the COVID? Answer, there's a risk management situation in regards to inconvenience. People don't have kids maybe, and so they don't know how important Halloween is for kids. If you don't have kids, I must tell you this is extremely important for their quality of life. Now, most of Halloween celebrations are done outside. This is celebrated outside. We said it. There are less risks outside than inside. Okay. Now there's the 2 meters. There's a person giving the candy to the children. And what we say, what specialists tell us, is that when you have contact for more than 15 minutes, there are more risks if it's longer than 15 minutes. I hope it's not going to take 15 minutes to give candies to children. But there are different people who are very smart, and they were telling us, who said that, by the way? They were giving us, what? They were giving us some tips to proceed with pipes. You can create some sliding device or whatever, so using pipes so that you could slide candies through the pipes to give them to children. Well, we're not talking about that. There are a few risks. We're not talking anyway about a bingo activity with 250 people in the same room for a whole evening. We're not talking about that. We're talking about children going outside, playing outside. Now, you cannot celebrate this with your friends, right? You can only celebrate with the people that live in the same house. So ideally, we don't go to the neighbors. Well, if it's possible for you, if you have a balcony, whatever, if you could put things, outside, it's even better. What about adults? No Halloween parties for adults. No, no, no. Question from La Presse. Good afternoon. The residents' patients, they are transferred to CHSLD zones, dangerous zones. They might be infected. Don't you think that CHSLDs might be overcrowded? Maybe the Hôtel Dieu will open some units. Won't there be any units opening soon? Answer, these two things are important. When I was informed about the article this morning about transfers and the transfers that had an impact on health, I would say health, mental health of people, I asked Ms. Marguerite Blais to do a follow-up on that because I understand what's the intent of this, why this was done. The idea was to protect them from a hot or dangerous zone. Now, there's a corollary here which has a negative impact. I might say that Ms. Blais is currently discussing with our staff members so as to see if this is the best way to proceed. We've tried to limit things as much as possible because a lot of transfers like that occurred during the first wave. I think we must find a different solution. Please remind me of the second part of your question. The non-traditional sites at the Hôtel Dieu hospital, experts seem to say that this is a good way to proceed. Answer. We've asked Dr. Opaterné to prepare the type of sites which I would call dedicated sites. We're not there yet. We don't need them yet. But the Hôtel Dieu Hospital is a type of a facility, a place where we could do that. We've asked them to prepare the rooms that we might need, but we're not there yet. So when we have a dedicated site like that, which was not used, we need to transfer staff members also. This is the challenge right now, because if we had hordes of people, a lot of people, they would be already there. But today we have to try to see where staff will be most needed. We have to keep the nursing staff where it's most needed first. And if we're forced to do it, we don't want that, of course, but with 450, 500 beds that would be taken, let's say 300 beds in Montreal, we're still okay at those levels, but things don't need to be exacerbated. Question. This is about the rise in deaths. There were 64 deaths in the past week. They are more than 60 years old. Are you afraid? Do you fear the situation in regards to our elderly people? The average is about 10 deaths per day. So we see that this is, again, a situation where most vulnerable people die. Our youth, people are impacted. A few young people died, maybe, but this is almost an anecdote. It's mainly the elderly people that die. So we have to consider our CHSLDs, mainly the RPAs. Well, it's not really an issue. It's their choice. But for residential and long-term care centers, the CHSLDs, we had 32 of those facilities where we found some COVID cases. 32 out of 404. There's more than 400 CHSLDs. So this is too much for me already. We're really monitoring that closely on a daily basis because these cases, well, they were infected because of employees or through some visitors, some guests in the facility. Anyway, my main concern, it's that one for now. Even though we have a protection and a monitoring system which is extremely solid, the risk is still there. Now, you didn't ask me this question, but I take advantage of the mic to tell you that the deaths that we have in the CHSLDs, they don't go through hospitalization. People have to realize that. When we give you statistics about the number of cases which would be transferred to hospitalizations and deaths don't go through because often one person will prefer to die at a CHSLD. That's why I was uncomfortable about your first question. People say, if I am positive with COVID, then I prefer to end my life here. That's what people say. It's very important for us not to create cases then, because otherwise we will have a lot of deaths at the residential and long-term care centers, at the CHSLDs, and we have to avoid that. Next question.
Bonjour, messieurs. Monsieur le Premier ministre.
Good afternoon, Mr. Premier. There was a change. The Deputy Minister is different now. There was a change of guard at the department, so the Department of Education. So this is rare. For Jean-François Robert, what's your message? Do you want him to change anything? Answer. It's rare for Deputy Ministers to be transferred. Or no. Question. No. When things are going well, it's rare that we change things. Answer. On a regular basis, there have been changes of deputy ministers. I've been there for quite some time in the world of politics, depending on the party, but there, on a regular basis, you can see deputy ministers being changed. Now, the education department is a big department, and currently there are even more pressures on the department because of the pandemic situation. There are huge projects, new schools, beautiful schools, the daycare centers, maternelle 4 ans, 4 years old. It's a huge management challenge. The person that we appointed, Alain Sancartier, is a wonderful manager. We've appointed him. This doesn't mean that the former deputy minister was bad. No, but the new person has a huge challenge, and because of this huge challenge, we decided that it was fitting for us to have a new person at the educational department. This is not a message that we're sending to Jean-François Robert. No, this was done with Jean-François' agreement. Question. My colleague from Radio X has mentioned this, Dr. Arruda. There's a study from the World Health Organization. We don't have a lockdown right now, but will this taint your thinking when the World Health Organization comes up with those statements? Does that influence you? Answer. We've always enforced their recommendations. We're close to the World Health Organization. As the Premier said, we are not in a lockdown situation. The World Health Organization makes statements for the whole world. They fear that there might be loss of revenues and huge issues created by the lockdown. We've had some compensations provided in our society still, but you need to reach the right balance. There's a fine line here. It's hard to do. The best message for us is that we will do what we have to do in our own environment to control infections, to monitor the situation, to protect workers, to protect the elderly. We'll make sure that we can conduct an inquiry on cases with tracing. And another component that's been stated by the WHO, it's engaging the community. We're doing that. We're engaging the population, telling them what they can do, what can you do in order to help us so that we don't go back to a lockdown situation, because these decisions are extremely hard to make. We make those decisions in view of life, death, because we want to protect our health system, our healthcare system, because if people have other disease, other types of illnesses, they have to be able to take advantage of the healthcare system and the network, and people have to be able to return to school if they need so, and so on.
Halloween costume. I had a great costume of Mr. Arruda playing. So anyway,
Okay.
And I want to ask Mr. Arruda, actually, the situation in Montreal, obviously Montreal was one of the first to go into the red zone. What can you say about the situation in Montreal now and how the cases are?
The situation is still fragile, and we're comparing to what happened this spring. There is not only the situation around Montreal, which is critical, I can say, but not in panic. We are not under control. We are stabilizing the thing. But any movement, especially in those big cities, that people will relax their distancing, their mask, their hygiene, can make pressure in our hospitals and come back with big problems.
And I wanted to ask you about the death rate, because we obviously saw quite a jump today. Are we still seeing, but the second wave has been a much lower death rate than the first wave. Do you, with the cases of the people who are being infected now and the way it's playing out, do you see the death rate at this point staying at a lower level than we saw in the first wave?
I hope so. I hope that the elderly people, which are more at risk, and the ones who have medical conditions, not be exposed to that. I hope that if there is some cases in our CHSLDs or elderly homes places, that we're going to be able to control that situation. But don't forget, if you are more than 70 years old, if you have any medical condition, you're at a higher risk. Now, what is important is to protect those people by the way we are putting the measures around. And if you're young, if you have active life, take care of the elderly, because they are the ones who die from the disease.
If you permit me one more, I'm wondering if the virus seems to be at a less deadly, I guess has evolved to be less deadly than we saw in the first wave.
In fact, it's because it's not the same population that is exposed. We had elderly people in CHSLDs, and those ones have been the death rates. If the virus circulates again in contact and people don't protect themselves, we will probably see those rates go up. But I think from what we know now, with the measure we're taking, it's exactly for protecting them that we are doing the same thing. But I don't think the virus is less deadly than it was before.
Thank you.
And maybe I would add two figures. I like that. 28 deaths for 8.5 million population. It's 3 deaths per million. Yesterday in the United States, there were 970 deaths, divided by 331 million, 3 deaths per million. So we have to take that seriously.
Question from CTV.
I'll start with the happier news of Halloween. You explained the guidelines behind Halloween, but I'd like to understand a bit more of the thought process that said, okay, Halloween is safe compared to other activities.
But first, Halloween is outside for most of the activity, so risk are a lot. The risk is a lot lower outside than inside. Second, we're asking people to go only with other people living within the same house, so we apply the same bubble principle. And thirdly, and that's where is the real challenge, we're asking people giving candies to do that at 2 meters of the children. So it means ideally you put a pot and you stay at 2 meters of the pot, and you ask, and you have small bags, and you ask children to take the bag, one bag, not more, and to don't touch the other bags, ideally. So I think it can respect the principles, and it's so important for children. I remember my 3 boys, they were talking about that for a month, and discussing which costume they will wear, and so it's very important, and it wasn't easy for the last 8 months for our children.
Okay, thank you very much. On to a bit more of a downer question, but at first it was the karaoke bars that had issues. Now it seems like it's bingo halls. Is there, Mr. Dubé, you said it very clearly before, but up until now, has there been a breakdown in that messaging, that communication that people are not understanding?
Well, I'll take that. I think people sometimes are very good, and I saw a couple of articles on that subject, but I'll say it very quickly, are very good at finding the little hole in the law, in the principle, in the directives. And I think that what we should tell those people that can find the little thing that they could be technically allowed to do, to use their creativity in protecting the people that they have asked to come to a bingo. And that's the only thing I'll say today.
But you said it very clearly in French, bingo,
That's it.
not allowed.
No more bingos.
We'll take the next question.
Hi, Steve Rukavina from CBC. Monsieur Legault, you talked about it appears the cases are plateauing at around 1,000 cases a day. But can we really say that if we appear to be testing fewer people over the last 5 or 6 days? So is that a real accurate reflection of the trend?
Okay, first I'll let Christian answer, but when you look at the percentage of positive cases divided by the number of tests, it's decreasing. So
maybe one of the reasons that we have probably less tests is that we've been very clear on the people that we wanted to test as prerogatives. Remember, we said either you had been infected, that's obvious, and you think you're infected, you think you've been in close contact with somebody that has it, or Santé Publique called you because you were part of a chain that we need. So I think we saw that the number of people that are coming to test are more in line with this rules that we've put together. So that explained, I think, the decrease in number of tests, because we were able to test at one point up to 35,000, and now we're testing on average about 25,000. So that's the main reason. Now, exactly what the Prime Minister said, we'll see how the variation will be on the positive, because we're changing also, we're changing the population that we're testing. But I think that the big change is on the number of people that we've asked to come first. That's probably the main reason.
On another subject, protecting healthcare workers, we saw this study that suggested that during the first wave, healthcare workers were, I believe it was 10 times as likely to contract COVID-19. Yeah. What more are you doing now to protect healthcare workers?
Yeah, as I said earlier, and I think I appreciate the question again in English, I think people realize that we've done a lot since the period that this survey was about to the mid-June. And remember that during the summer, from June to August, when I prepared the plan for the second wave, we took note of all those things that happened. So I think people need to also to be reassured first that the situation that we live in our CHSLD hospital is quite different than what we had in the first wave, that's for sure. If anything that need to be improved, and I think I take the example of N95, they have been asked by LAFIC, and we're sensitive to that. We will see, but so far the expertise that was prepared by different analysis did not require it. But I told Daniel Desharnais and our people that are responsible for that now, if we need to improve, if we need to change that, we will, because we don't have at all an issue of protective equipment. We don't have. This is a big change that we have done over the last 3 months, assuring that we have ample provision of masks and everything. So, but we'll see if we are being advised to change our mind on that, but we're sensitive to that.
Thank you.
We'll go with Gloria Enriquez.
Thank you. Good afternoon. I'm going to pick up from my colleague from CTV who asked you about messaging. When you see this situation at Boisbriand, the bingo, how do you feel? Do you feel tired or discouraged that the message is not going through?
Right. No, I'm not a person that is that you can discourage lightly, easily. I'm annoyed sometimes because as for the bingo, as I mentioned, I think that I'm even surprised that people don't realize those organizers, even though they found for now the way to say that they understood that they could do it. This is not the matter of saying that you could or not do it. Should you do it? Should you invite people, age people, in a room that they will yell and say they're happy that they won? I think that's a lack of judgment. I'm sorry, that's a lack of judgment. So that's a bit annoying. I'm being very transparent. And I think that and that's the reason I'm making this comparison, that I hope that people will understand that bingo should not be the karaoke that we saw in Quebec City. Remember how many people got infected in Quebec City with the karaoke? And I think that if there is something that I'm asking those organizers, whatever they are, in the orange zone or in the red zone, and they could do it and now they cannot do it, please use your judgment and make sure that we protect our people, especially those that would be more affected. And we already, Dr. Arrucio has commended some testing already in Montérégie for that, in Saint-Jean-sur-Richelieu. Hopefully we'll be able to control that because so many people would have been in contact. We don't know that. We'll let Santé Publique in Montérégie make the necessary work. But hopefully that's not going to be as severe as what we saw in Quebec City.
Are there efforts being made to ramp up contact tracing, or is that on hold?
I'm sorry?
Are there efforts being made to ramp up increased contact tracing, or is that on hold?
You mean in terms of the application or in terms of?
In terms of like following up with people who are infected or might be.
We are ramping up. You remember we said that we had an issue with personnel in terms that we're probably close to about 800 persons that we have right now, just a bit above that. And we need probably a lot more. Probably is a soft word. We certainly need a lot more. We have a new sous-ministre, how do we say sous-ministre? Deputy Minister?
Deputy Minister.
Thank you. We have a new Deputy Minister that joined us Wednesday that will enter on Monday in Mr. Arruda's team. This gentleman Jérôme Gagnon will be responsible for what I call operation. And operation is testing, is everything, vaccination. So I think that will allow the group of Dr. Arruda to go on the advice side, but I think we need to put a bit of operational side in santé publique, and that's this gentleman is joining, in fact, Friday afternoon for a meeting with everybody, and will be in place on Monday, just to coordinate all the operation side of santé publique.
Thank you so very much.
Merci beaucoup tout le monde, bonne journée.
Happy Halloween. on va se revoir avant ça.
Happy Halloween, and we'll see you before that.
I think we're probably seeing you tomorrow.
Merci beaucoup, c'est gentil.
Thank you.